Welcome to the fabric of our community. Today we do have an amazing guest. His father introduced him very early in life to the health and wellness sphere, and he integrated that into his practice as a dermatologist. So much to talk about. I'm so interested. And of course, we're going to talk about all of those things that dermatologists talk about. So it's going to be a fun episode. We'll introduce you to Dr. Ron Prussick. I'm Traci Mitchell.
Hi, I'm Joel Greenzaid. I'm president and CEO of G Street Fabrics, and welcome to the fabric of our community, where we honor individuals that have made an impact on our community. My co-host is Emmy award-winning journalist and author Traci Mitchell. And today we have a very good friend of mine who I've really known for about 30 years, and Dr. Prussick, one of the top dermatologists in the metropolitan area, a humble and brilliant man. And but we started off as friends, and then he has a wonderful family, beautiful wife, beautiful daughters, and we started as friends. And then since then, our whole family basically goes to see Dr. P. Because like I said, he's the best in the area. So I just want to get started and, start from the beginning, and we want to hear your story.
Well, thank you both for that wonderful introduction. I appreciate you inviting me to come today. So my story is I'm born and bred in Montreal, Canada. So my mother was American, my dad was Canadian, and they met in the Catskills on vacation in the summer and got married. And so I grew up in Montreal in French Canada. So I speak French and English, and I went to school in both languages. And I did my I went to college at McGill University in Montreal, and then I got into the medical school there, which at the time was the top medical school in Canada. And that was my beginnings. What I grew up with was my dad was very interesting in that he opened the first gym in Montreal in 1941. He was 20 years older than my mom, and he was born in 1914 and she was born in 1934. And he didn't look a day older than any of my friends' dads that were 20 years younger than him.
Wow.
And so he was influenced by someone named Bernard McFadden. Bernard McFadden started something called the Physical Culture Institute. And he wrote a lot of magazines, and he wrote a 5-volume encyclopedia on physical culture, and I have that at home. Wow. And my dad started the business, and his name was Preston's Institute of Physical Culture. And his best friends growing up were Joe and Ben Weider, and they started the Weider Corporation. They made barbells and gym equipment. And then Joe Weider moved from Montreal to California, and he started Muscle Magazine and the supplements, and he brought in Arnold Schwarzenegger from Austria to California to promote all that they were doing.
So he's the reason we have Arnold Schwarzenegger
Yes.
here in America. Okay,
Yes.
That's fascinating.
Yeah, that was Joe Weider who brought him in.
Right.
So that was, so I grew up with a gym in my basement. I grew up with a dad that even in the 70s was into working out every day. We didn't have any.
He was lifting weights too.
Yes, yep. That was part of the physical culture. Wow. So what they learned in physical culture was that you can actually treat your disease and prevent disease with physical exercise and diet. That's what the 5 volumes of books is all about. It's sort of an alternative to medicine. So doctors didn't really like that theory.
No.
Because they were pushing more medications and other things, whereas my dad and his friends and this group were all about diet and exercise. And my dad would say, my food is my medicine. Wow. Okay, so this is what I was growing up with in the 70s. Now in the 70s, for example, everyone in Montreal was smoking in restaurants, in grocery stores, and my dad would be telling the people sitting next to him in the restaurant to stop smoking. It's bad for you. He doesn't want to breathe in their smoke. And everyone thought he was a lunatic. And he told me that in the 50s, he would go to the doctor's office and the doctor would be smoking when he goes to visit him. And he would tell the doctor to stop smoking. It's not good for you. So that was what I grew up with. And so when I got into medical school, one of the top schools in the country, he said, have an open mind going to medical school because not everything they're going to teach you is going to be right. And he gave me examples of the doctors smoking. And he gave me examples of the doctors were promoting smoking in magazines and on TV, saying there were some health benefits for that. And so, he wanted me to have an open mind going to medical school. So this was my upbringing.
But
So
why
we had
medical school? I'm just wondering if you're growing up in that health and fitness
I thought I was interested in science and I was interested in helping people. So, for me, I always got pleasure of helping other people, and I thought medicine would be a good way to do that. And you don't necessarily have to go to medical school and only treat with medications. You can treat with complementary medicine. So that's how I do it. I do the general medicines traditional medicines, and I add complementary diet and health. So you can do both. My dad was alternative, where there was no medicine, and I'm in the middle. So that's how I do it. And for me, going to medical school, I was good in science, and I had a really great ability to retain what I read, so I knew I can do it. And I wasn't as good in English and writing. I think it's because I was doing French and English at the same time in school, so I mixed them all up, and I just wasn't as good as I was doing math problems and science problems. And I'm a good visual learner. So I can read something and look at something and remember it, and that's why I got attracted to dermatology as well.
Did you know you would do dermatology right away? Was that...
No, I didn't, no.
So how did you come to that?
It was just more of a coincidence than anything. What happened was, in my medical school, you leave the classroom early and go into the hospitals early, and then the last 6 months of medical school, they allow you to come back to school and do something that interests you. So you can take classes of your interest. And what I wanted to do is I wanted to do a research project because I was interested in science. And so they actually paired me with a dermatologist. In those 6 months, I got to work in the dermatology clinic. And I did a research project on what they call candidiasis in mice. So basically, we were looking at these different strains of genetically strained mice. We wanted to find the genes that made them susceptible to a yeast infection, a skin yeast infection called candidiasis. So that was my research project.
You were young then, too.
I know, right?
You were playing at a high level then, huh?
Yeah. I went to medical school at 22, so I finished at 26, so 4 years. So I was 25, 26. I wasn't quite 26 when I graduated. I was 25.
So how did you end up down here in this area?
Well, what I did is I did my dermatology training. After I finished medical school, I went to University of Toronto to do my internal medicine and dermatology. And at that time, I worked with someone named Ricky Schachter. She was my mentor. And she started something called the Psoriasis Education and Research Center in Toronto. So while we were residents, we took care of patients who had very severe psoriasis all over their body. And we did research projects. They were hospitalized, some of them, they were so bad. And she was way ahead of her time because she understood that this affected people psychologically. And we did rounds in the hospital with a psychiatrist once a week and a rheumatologist because it would affect their joints. And she was very great mentor for me. She was the first woman in her medical school class in the 1940s and the only Jewish girl and only Jewish person in her medical school class in the 40s. And she was excluded from a lot of classes. She couldn't eat lunch with the other men. And she was tough. Tough skin, so she was able to deal with that very well. And she was very hard on us as residents too. She made sure that we knew what we were doing, and if we didn't, she let us know. So there was no. She wasn't shy to let us know that we needed to study more. And so she was my mentor. And so I got very interested in treating psoriasis because I saw how the patients were suffering. They had visible red scaly patches all over their body with extreme itching. So if you've ever had an itch before, these are people who had an itch 24/7, 7 days a week, constantly. And because it's a visible disease, they were affected psychologically by this because people would make fun of them. I had patients that lost their jobs because they had these red scaly patches. I had patients that were thrown out of public swimming pools because they thought they had a contagious disease. I had patients that lost their jobs because of it, serving food or bank tellers and things like that because they had visible red scaly.
I'm jumping ahead, excuse me, a little bit, but I know that you're actually well known nationally and internationally for your study of psoriasis. As you've been your dermatologist, you've also done a lot of research,
Right,
and spoke around the country.
right. So this is how it evolved. So my interest in psoriasis got to the point where I wanted to do more because at the time we really couldn't do very much for the patients. So that's how I ended up here to answer your question. So I studied at the National Institute of Health. So what I did study was immunodermatology, which means how the immune system affects the skin. And psoriasis is one of those diseases that's affected by your immune system. It's a systemic inflammatory disease that manifests itself as on the skin, as a skin rash, but it has to do with your immune system. And for me, that was very interesting because I got to study how the immunology works. And for me, one of the interesting things that I wanted to learn about was how diet and exercise affected your immune system that would help your psoriasis. And that's how it all came back to me. So I went to the NIH to study that immunodermatology, to study the immune system better. And that's how I ended up here in Maryland to answer your question.
Okay, right,
So
perfect.
my question is, does it work? Food and exercise, does it help?
does.
Yes, it does. So I've written a lot of papers on that, and I've given a lot of lectures. I'm on the medical board for the National Psoriasis Foundation, which is a nonprofit organization. I've been on their medical board since 2012, and I've been able to lecture to a lot of students, a lot of residents, a lot of dermatologists over the years. And one of the things I focus on is how diet and lifestyle can help patients, can help their immune system and improve their disease. It doesn't necessarily always cure them, but it can help us managing their disease and help them feel better. And so I've written lectures on that, and I've given them nationally around the country. About diet and lifestyle. And we've written papers on that through the National Psoriasis Foundation.
Very nice.
Mm-hmm.
So then you're here, and I can't say it enough, but Dr. Prussick has had a very big impact on the whole study of psoriasis and the improving of psoriasis nationally. I mean, it's a big deal. So then you set up your office here as a dermatologist.
Right. And the reason why I did that is.
Were you married then? Were you?
Yes, I was married. I was married in medical school. I was married early.
Oh, wow.
So, and Lisa was already born in Toronto, my first daughter.
Right.
And then the other two daughters, Jessica and Stephanie, were born here in Maryland. And so the plan was to go study at NIH and go back to Toronto and work at PERC. And then I got interested in staying here because I wanted to continue my studies at the NIH, although still see patients, and I missed seeing patients. I didn't want to just do research. So the advantage of staying here was that I can still volunteer at the NIH because my office in Bethesda was a mile away from the NIH. So what I ended up doing is I saw patients, and then I would also volunteer at the NIH, and we did a big project. I worked with a cardiologist because patients with severe psoriasis live 7 years less than the general population, and they were dying mainly of heart attacks and strokes. So this cardiologist, his name was Nehal Mehta, who was also on the National Psoriasis Foundation Medical Board, got an NIH grant to study systemic inflammation in psoriasis patients because the inflammation was damaging their heart. and they were getting, and their blood vessels, and that was affecting their risk for heart attack and stroke. So we were studying, we were doing, they were called fluorodeoxyglucose PET scans. So we're looking inside the bodies of our psoriasis patients to see whether any of the treatments we can do would take the inflammation out of their body and reduce their risk.
Did you find something?
We did, yeah. We found that when we were able to clear their skin, that correlated with the improvement in their liver disease. They had inflammation in their liver and in their heart. So we found that the more severe their psoriasis was on the skin, the more inflammation there was inside the body. And when we were able to clear their disease with the various new treatments that we have, we were able to see an improvement in their inside of their body. So that's why, I wanted to stay here and work at the NIH.
That's beautiful. I want to talk about the progression from when you started as a dermatologist in this area.
Yeah.
And, the progression of, it went from, sun and sunscreen, and then I know it evolved into other things like Botox and fillers. And tell us about that evolution, how dermatology, even in your time, has changed.
It's changed a lot. There's a lot more patients who are educated about skin cancer and melanoma and things like that. When I first started in practice 30 years ago, patients did not have a desire to do a full body skin check. They would have things checked, but they wouldn't ask me to do a full body skin check. And now it's one of the most common things I do now is full body skin check. So there's a lot more awareness about skin cancer now than there was back then. And there's a lot more awareness about the use of wearing sunscreen every day. And
Dr. Prussick taught my whole family about Elta.
Right. It's a
daily
good
use of Elta.
I love it. I use it too.
The basic idea is to use a zinc-based sunblock every day. It doesn't matter if it's raining. It doesn't matter if you're driving. Because the UVA rays, which are the aging rays and the rays that give you pigmentation on your skin and give you wrinkles, they're the longer wavelengths. They go through windows and clouds. So using a high SPF doesn't necessarily block those rays. The high SPF blocks the UVB rays, the burning rays. So that's why you have to integrate the UVB block with the UVA block. That's what the Elta does. It's got the zinc in it. So if people buy a zinc-based sunblock and at least an SPF of 30 or higher with the zinc oxide in it, they'll block all the rays. And they have to remember that it's not just for the beach. It's got to be something you want to wear every day because the UVA is there just as much on a snowy day in January as a sunny day in July. So it's not something that you should not wear every day, as long as you're leaving the house.
Do you wear it on your entire body, Joel? Or is it
I've
just
been
your face?
taught face from
So that's
Dr.
what I was going to
Prussick.
ask you, because I do face.
Yeah, but it depends if you're exposed or not. Most people are, if he doesn't need it because he's got clothes on here. So unless you could use it on your arms when you're driving. Yeah, because what happens is you're going to get brown spots and sun damage on your hands and arms, and your skin ages with a lot of pigmentation.
Yes.
So less wrinkles than my skin type, but more pigment problems.
Yep.
And so the pigment problems are best dealt with early by using the zinc-based sunblock. And that way you don't get the pigmentation.
It's like a doctor's appointment and I don't have to pay for it, right?
It's great.
Okay, so I do have another personal question. Can I ask a personal question? Do you mind?
Please.
Okay, so I don't think I've even shared this with you or anybody else, right? So I've had, probably about 10 years ago, I found this silly little bump. It's like almost like a divot on my upper chest. And I kind of watched it and I went to like all of these scans and everyone's like, it's normal, it's a cyst, don't worry about it. And I was like, I just don't like it though. It's like a divot. Who has a divot in their skin? And then it turned purple one day. And then I freaked out because they said, why is it purple? And I remember going to, I forgot, I went to someone I said, can you just cut this out? And I think it was an oncologist. And he goes, why are you at an oncologist office? I said, because I'm just having a bad feeling. It's purple. And they cut it out and it had legs. And I said, why does it have legs? And he goes, I don't know what this is. And I said, and what's the brown thing? He said, that's your skin. It wouldn't let go. And I was like, what is it? Like, I said, let me see it. So I'm like shaking it in the bottle, right? No. It turns out it was DFSP, dermatofibrosarcoma protuberans. Did you know what it was before I told you?
Well, I thought it would be that or just a dermatofibroma. They're both divots, and so we can tell them apart from the biopsy report.
Where were you when I needed you? Like, I'm like freaking out going, I have a divot.
Right,
Right?
yeah. So those are things that you need to biopsy. Yes,
Right.
yeah, absolutely. You were smart to get it checked out, yes.
Tracy, very smart.
You know, I mean, it's kind of amazing that you know these things and that you've built, as Joel said, such an amazing practice studying these different things. Like, how do you, I guess, retain it all?
Well, I think, the thing that attracted me to dermatology is there's not just 5 or 6 things I'm dealing with every day. There's
Right.
really hundreds, if not thousands, of skin conditions, and so books with 3 volumes. So it was really interesting of the variety of the diseases, and also I deal with people who are just born to the oldest as old, so all age groups, both sexes, so we have a really wide variety of what we can see. And that's what I liked about dermatology is the variation. I don't know what's going to come in next. And DFSP, like you have, is a very rare condition.
Yes.
There's not that many people a year that get it in this country, so it's quite uncommon. And so that's what I liked. I liked the rare, uncommon things. And the reason I retain things is it's genetic. I mean, I got a gene from one of my parents, so it's not something I was able to do. It just came with me, came with my wiring.
That's amazing. I threw it out there because
No.
it's such a rare thing that his like your eyes kind of lit up a little bit. I was like, you know what I'm talking about, right? I had no idea, but the fact that you know is astonishing because it is rare.
A brilliant doctor.
Right?
I said that before. Now I sort of want to just move into the cosmetic side of it because I know that's really
Super popular.
gotten very popular, yes.
Yeah, it's very popular. Well, along with our understanding of the skin came, understanding of what caused the aging of the skin. So we talked about the sunscreens, and then came a lot of products that help improve the look of the skin, like retinol and retin A and things like that. And that came in the 80s and the 90s.
Is retinol and retin A through a cream?
Yeah, those are topical products.
And do
That's
they
right.
work?
Yes, they do work. Yeah, most dermatologists use a retinol or we call it retin A, tretinoin, different things. So we'll use that on our skin because it's the thing that's been proven the most to improve fine wrinkles and get rid of textural problems, so brown spots and even out the skin. So most dermatologists will use a good sunscreen and will use a retinol or a retin A type of product in the evenings. So those are important. And then over time, lasers became better understood through scientific discoveries. So what lasers are basically machines that emit one wavelength in a very high power. And so generally when you're looking at light has multiple wavelengths. And so lasers is just one wavelength, so it's very specific. And the lasers hit a specific chromophore. So a chromophore is the color of something, is that wavelength is just absorbed by only one color. So for example, if you have a red spot or a brown spot, we actually have lasers that are attracted to that brown spot or the red spot, and the energy of that goes into the red or the brown spot without going into any other parts of your skin. So you can be very selectively getting rid of things without actually damaging the skin and scarring it. So that's what became very popular with the lasers, is they were able to produce things with such a high energy that it happens so quickly that just the brown spot heats up and the heat doesn't go to the rest of the skin and cause a scar. So we're able to remove a lot of damaged spots, red birthmarks, brown spots, sun damaged spots with lasers.
And it works on all skin, like my skin, Joel's skin.
It first started out with just Joel's skin,
Right, exactly.
because your skin has pigment on top and the lasers weren't able to get through. Your skin would absorb the wavelength, so it wouldn't get into the brown or the red spot underneath it. So the initial lasers were only good for Joel's skin. Now we have lasers that we can use on all skin types. So for example, when I first started laser hair removal in our practice with my nurse Meryl, we only had a laser that can treat dark hair and light skin.
Right.
And it couldn't work in your skin type. But now we have lasers that actually have wavelengths that can bypass the pigment in the surface of your skin and get in there. So we can do both now. So that's evolved over time.
I feel like I should mention Meryl, who is just one of the greatest ladies, and I know she's worked with you for many, many years, and most of the women in this area know her.
Yes, Meryl is very, very popular, and
Yeah.
she's an RN, and she's started out as an OR nurse over the years, and then as she had a family, she wanted to transition to more a 9-to-5 job, and she was working with a plastic surgeon, and then came to work with me over 25 years ago, and she does all the cosmetic work in my office. She does laser hair removal, peels, Botox fillers, and things like that. So Botox came out probably in the late 1990s. It was a couple in Vancouver, Canada that first described it. And I went up there to train with them. So the wife was an ophthalmologist and the husband was a dermatologist. And so she was injecting Botox around the eyes for people who had muscle spasms. So they had tics in their eyes and they were doing spasms all the time. And what she noticed was that when she was doing that, it helped them, but also the wrinkles went away. So the dermatologist who was working in the office with her said, this is going to be good for wrinkles. And so he did the initial studies, and that's how Botox came about. So basically what it does is it relaxes the muscles, and if you relax the muscles and you're frowning a lot, we use it a lot for forehead muscles and around the eyes in various areas. By relaxing those muscles, the muscles calm down, flatten out, and the lines flatten out as well.
And it's safe.
It's safe to use. It is a toxin, but
That's
the
what I was
thing
gonna
is,
say. Yeah, it's kind of weird.
at the beginning, people were like, "Wow, they're injecting something that's so toxic into the body," but because it just stays in that muscle and it doesn't migrate into the bloodstream, and we use safe dosages, you're fine. If you use too much of something, it's no good. Just like even an aspirin or a Tylenol. If you take too much of that, you can get sick. But if you take the proper dose, you're okay. So we've been using it for more than 25 years now, very safely, as long as you go to a reputable person who actually uses, there's some compounding pharmacies that'll make cheap stuff for some doctors, and those are the people that can end up with problems because they give people too high a dose. And that's happened over the years, but it's very rare. And if you go to reputable doctors that use the right dosing and are properly trained, and didn't just take a weekend course, you're okay.
And what about, I see more young people doing it. I mean, people even in their 20s. And I think for me, it's just a matter of perspective because it wasn't around in my generation and it's around now, so they're trying it. I mean,
yeah, well, the thing about Botox is you can do it early on because it prevents things from happening. So if you know that your mom or your dad has deep 11s in your forehead, 11s come from 3 strong muscles from frowning all the time. So, we all end up looking like our parents. So basically, if people can see that it runs in their family, that they have very deep lines on the forehead, they start in their 20s because what it does, it relaxes.
Prevent it?
Yeah.
Wow.
So
Wow,
the way
who
I
knew?
describe it to patients is like Botox does what a cast would do to a bodybuilder's arm. So if you take a bodybuilder with thick, big muscles and you put them in a cast for 6 months, the muscle will atrophy and weaken, and that's what we do with Botox. So the Botox, those strong muscles, and you can even see it in children and teenagers, and people in their 20s start to see that line forming and they can see what's coming. So they come in and get a little Botox there to prevent it. And that's what we do, and it works.
So the line's not going to form.
They'll never form because the muscles can't get strong enough, because you can't, it's like putting your arm in a cast. And
so you've just weakened the muscle.
You're weakening the muscle, because if you look at those people with the deep 11s, it's because they have 3 bulging muscles right next to each other. The 11 is the groove between the 3 muscles. If you make those muscles flat, there's no groove and they don't get the 11s. And same with the lines on the forehead. Those come from raising your brow all the time when you're making facial expressions. Right. So the muscles thicken up to the point where even when you're relaxed, the muscles are so thick that a groove forms between them and you get these deep lines. So the Botox will prevent that by relaxing the muscle, and the muscle doesn't contract, and you can't make those facial expressions, and you don't get the lines.
How often would you have to, how often would you have to do it?
It really depends on how thick your muscles are. For young people that don't have thick muscles, they do it twice a year. And for people that have thicker muscles, they can do it 3 or 4 times a year. Yeah.
And what is fillers?
Well, fillers are just adding volume back to the skin. So they're made out of, most of them are made out of something called hyaluronic acid. So in your skin, you have like bricks and mortar. So the bricks are basically the collagen, and the mortar is the hyaluronic acid. That's the stuff around your collagen. So over time, the cells that you make produce less of that mortar, less hyaluronic acid with age, and you could start seeing fine wrinkles in the skin for that reason. So what we do is we just replace that mortar, the hyaluronic acid that you don't have as much, with the filler. And the filler just, we put it into the area of the skin that the patient needs it. It could be on the superficial dermis or the deeper dermis, and we volumize the skin. Usually we can do a lower part of the face. So the nasolabial folds, we can do the lips, we can do the jawline, we can add a little bit. They have fillers now to improve the actual fine wrinkles on your cheeks as well. You can do it in different places like that.
And it works.
It works, and it lasts 6 months to a year, and we even have products now that last more than a year. And we can actually, there's ones where you can put the volume into the cheek to actually do it a little facelift by doing, we call it a liquid facelift, where you can actually add a very thicker volumizer to bring on the bone to lift the cheek up. And so we can do that as well for people.
Have you found that over the years, being a dermatologist, that more people are heading towards the whole cosmetic, like changing the look or not trying to age, more so now than before?
I think there's a generational change. I think the baby boomers started it. Probably their parents aged more gracefully. The baby boomers want to say, well, the 60 is our parents' generation's 50, or or the 60 is, they want to be 10 years younger than their parents did. So I think the baby boomers started it, and their kids are following what their parents did by being interested in those kind of things. I think the baby boomers are not aging as gracefully as their parents did. They want to look young, they want to feel better. Going back to the diet and the exercise, a lot of them are now realizing that their diet does impact their body, and the exercise will help them age better. And so this is all the same mentality. The way you look. So if they have a good diet and exercise and they feel really good, but they look at their face and they see their mother, or they see that their father, and they say, well, I don't want to look like my father. I feel much better than that. They come in and say that to me. I say, well, I'll try to make you look a little bit better that way. Because they don't always, when they look in the mirror, see the results of their good diet and exercise in their face. So we have to help them.
That's great. That's great. Yes, I just wanted to, keep moving with Dr. Prussick about where the field of dermatology is going. Where do you see it going moving forward?
Well, I think what's happening in dermatology is that there's a shortage of dermatologists in the country, especially medical dermatologists. So there's a shortage in the pure numbers of dermatologists being trained in the country, and also the fact that many dermatologists have become cosmetic dermatologists and not doing medical as much. So I think where it's going is there's going to be some help with AI, for example. So for example, doing skin checks, I think that there'll be some instruments that non-dermatologists will be able to put on patients' moles, and the computer or an app will be able to help them decide if this mole is cancerous and needs to come off or precancerous. So I think that we're going to have a lot of use for AI in dermatology from that perspective. And I think that there'll be a lot of understanding of the genetics of certain diseases that will help dermatology. So for example, we talked about psoriasis. So if there was a way I could do a blood test on my patient who has psoriasis to see their genetic profile, I would better be able to match the proper medicine for them with their genetic profile to get it right at the beginning, instead of trying this, and if that doesn't work, trying that and trying this one. So by understanding the genetics of people, you can better understand the best treatment for them. And I think those are the two ways I think that dermatology is going to evolve.
That sounds
Amazing.
good. Sounds amazing, like Traci says. So those are some good things happening. I know that recently you were honored at the Chevy Chase Club. Can you talk about that a little bit?
Yes, sure. I was honored by the National Psoriasis Foundation, which is a nonprofit organization that the goal is to help people with psoriasis and psoriatic arthritis. We call it psoriatic disease in North America and around the world. Help them understand their disease, help them get access to medications and access to dermatologists that actually know how to properly treat their disease and diagnose them properly, because a lot of people are misdiagnosed as having eczema, or they're misdiagnosed their arthritis as being something other than psoriatic arthritis. So the National Psoriasis Foundation has a medical board. So it's a medical board of 30 physicians. They're dermatologists and rheumatologists. And because of my interest in psoriasis, I was asked in 2012 to be part of their medical board. And so I did that for 6 years, then took a break, and now I'm back on their medical board as their vice chairman. And so what we do is we write journal articles on guidelines of care, on how to treat patients with psoriasis who are elderly or who are immune suppressed, or if they're pregnant. So we write all these guidelines for doctors around the world to read so they know how to better treat their patients with psoriasis. So I've been doing that for many years. We give lectures around the country virtually, or we go in person to medical schools. We go to residency programs. We talk to primary care doctors to educate them how to diagnose psoriasis so you don't mix it up with something else. Because a lot of red scaly rashes look alike, it's not always so easy for people to diagnose psoriasis. So the first thing we learn in medical school is you can't treat the person properly if you don't have the right diagnosis. So, we focus a lot on that. And then I focused a lot in my career on the medical board about how to integrate the diet and lifestyle into all the great new treatments that we have to treat psoriasis. All you have to do is turn on the TV and you see there's a lot of ads for a lot of different medications for psoriasis. And we've, through studies and through a lot of research, a lot of it was NIH-funded research, we understand the pathway of inflammation in psoriasis, and we can better have these medications that block that pathway without blocking the rest of the immune system. So we don't damage the rest of their immune system, we don't immune suppress them, so they can still fight off infections and not get cancers, but actually have less psoriasis. So we try to bring their psoriasis immune system back into a normal balance. We don't want to make it too low. And that's what's happened over the years. We're able to effectively treat people with psoriasis very well without having to damage their immune system or lower it and make them prone to other things. So that was the my goal at the start of my career was to actually, take these patients that were miserable. We used to call it the heartbreak of psoriasis. They were losing their jobs. They couldn't go to a swimming pool. And now patients come back and tell me, well, I went into a swimming pool with my grandchildren for the first time in 20 years. I went to the beach and I wore a bathing suit for the first time in 20 years. And so it's really great being a dermatologist because we can do so much to help.
And Dr. Prussick is being humble here, but it was a very big honor at the Chevy Chase Country Club, and I'm glad to see people are recognizing you, and they have been for years, but continue to recognize what you've done.
Right. Well, this is all volunteer work that I do, so we don't get paid for it, and that's why it was a volunteer award, because I do this on my own time.
Go ahead.
No, I was going to say, I think, though, it has such a big impact on the community because you are changing lives, right? And I think you're giving your time, but you're giving your time to change lives, because what I hear you're saying is what many people don't know about people who suffer from psoriasis.
Right.
Do you know what I mean?
Well, because psoriasis patients were always shy to talk about it because they wanted to hide it from people. Because it's visible, and people would say, what's that? Is that a scar? Or is it contagious? And so they didn't want to talk about it with all their friends and family. That's why being in DC when it's 95 and humid, they're wearing long sleeves and long pants because they can't wear what other people can wear.
And I think that's the essence. I mean, Dr. Prussick really told the story from the beginning, and it was amazing. But I think that's the essence of why we're doing this, Traci and I, and the fabric of our community, because with all the work you do, and I know it's not easy being a full-time dermatologist, and to be able to do this volunteer work, which helps so many people in the community, is, I can't say enough.
Well, it's something that I really enjoy. I have a passion for it. So one thing about being a doctor is you're not self-centered. You're giving. You're other-centered. So one of the things about being a doctor is your goal in life is to help people, and you have to have enjoyment out of it. So this is how I get happiness, by helping other people. And so that's one of the great things about being a doctor for people who like that, who like to help other people and get happiness helping other people. This is the great career. So I was able to influence my oldest daughter. I have 3 daughters. Lisa, she's a dermatologist in Boston. And my middle daughter married a boy named Dylan, who's they've been together since 10th grade in high school. And so he used to work in my office in high school and college, and he went to medical school, and he's doing his dermatology residency at George Washington University. And that's where I actually, I'm an associate clinical professor at GW. So, I get to teach the residents there. And so, and there's even some of my patients have gone into dermatology or medical school, like Johnny, for example, who got interested in medicine and worked in my offices.
My son Johnny, by the way, is one of Dr. Prussick's proteges.
Right. So he worked in my office on his summer vacations in high school and college, and got into Georgetown Medical School and just graduated this week. Congratulations, John. I'm very proud of him. So I do have a number of kids that are going my way because they saw that I enjoy what I do, and they were actually witnesses. My daughter, my son-in-law, John, all worked with me as assistants. They were able to see how much I can help people, and that's why they got interested in doing it too.
It's amazing.
So
I mean, I'm honestly, and I've known you for a while, but all these things you've talked about, it just blows me away. I mean, I can't thank you enough for being here. I mean, the impact you've made on your patients, the community, and young people.
Yes.
Yeah.
Trying to get into the profession and be doctors is incredible. It's fabulous.
Well, I think of medicine as you have 3 stages. The first stage is the learning stage. The second stage is going out and practicing what you learned. And I'm in the third stage now, where you're not just practicing, but you're teaching. and you're making sure that the young generation is going to be able to replace you. And so that was the great thing about teaching at George Washington University and being on the medical board of the National Psoriasis Foundation, is I can spend a lot of my time of the 30 years that I've learned to show them the way.
That's beautiful.
That's amazing.
Beautiful.
You're doing a great job.
Thank you so much, Dr. Prussick, for coming to the fabric of our community. Thanks for coming out to G Street. I'm in awe. Thanks so much.
Okay.
Thank you.
Thanks for having me.